United Health and Wellbeing Council, I welcome all of you to this Hemophilia Awareness Session, which is an initiative by IHW Council and supported by Roche. I am your host, Dr. Behjat, and today we'll be discussing about breaking the silence, understanding hemophilia. And to discuss about this rare blood disorder, I have with me a very special guest. Please join me in welcoming Dr. Ramana Dadamudi, who is a pediatric hemato-oncologist at Little Stars and She Hospital for Women and Children, Hyderabad. Welcome to the discussion, sir.
Good evening.
So without further delay, I would just start the discussion. And if you could, sir, at the very start, give us a brief overview of what hemophilia is and why it is essential for the public to understand this condition.
Yeah, certainly, hemophilia is a bleeding disorder. Basically, it's a genetic problem. We see 1 in every 10,000. Hemophilia is a factor deficiency. If it is being involved with the factor VIII, we call it hemophilia A. If it is being involved with the factor IX, we call it hemophilia B. Okay. Usually, they present when in early age, around the age of 6 months to a year, up to 2 years, we can see. Usually, they present when they're crawling or when they're trying to walk. Small bruises appearing on their skin at various parts of the body. That's what make the parents to realize something unusually it is happening. But again, it's happening repeatedly, even with sometimes with the falls or some hits, sometimes spontaneously. Then the parents get kind of realize there is something happening. They tend to bring to the doctors. And then when doctors just realize that there is a bleeding into the muscles, joints, or in the skin, more than to the extent of the trauma or fall, the doctors then they can subject some simple tests. They can, probably the tests give a lead towards some definite problem with the bleeding. And doing a confirmatory test like factors, particularly factor VIII and IX, we can confirm the diagnosis of hemophilia. Usually hemophilia is 3 types, whether it's a or B, whether it's a factor VIII or factor IX. The one is a severe type where the factor less than 1%, they can have a bleeds without any provoking falls or trauma, that is called spontaneous bleeds. If their factor levels between 1 to 5%, we will call as a moderate hemophilia. If factors are more than 5%, we call as a mild hemophilia. In moderate hemophilia, probably they will have bleeds with the trauma, falls, or anything provoking. Even in a mild, usually they bleed only if there is a significant falls or trauma or any cuts from the body. They can bleed excessively.
Right, sir. Now, owing to the rarity of the condition, there are a lot of myths associated with the disease. So in your practice, what are some of the common misconceptions that you have come across and would like to clarify regarding hemophilia?
Yeah, definitely. It's not a common disorder. And if we see the incidence is around 10,000 in factor VIII, and if it is factor IX, is 1 in 40,000. It's very rarely you would see, but often the families can be misled. They think something else happening, just they try to nag, kind of, unless if there is any major bleed, they don't realize or they don't bring to the doctor's notice that something to be investigated. So often in initial phases, it tends to be missed. So certainly the family history something can kind of make the parents or family to realize something happening, and also instantaneously doctor gets involved and starts investigating. So it is very important if there is anybody in the family being involved to bring to the doctor's notice immediately.
Other than lack of awareness and late diagnosis, what are the other challenges that families face when somebody is, especially a child, is diagnosed with hemophilia? So of course you talked about lack of awareness, misdiagnosis. Once it is diagnosed, what are the obstacles that you feel families face?
Usually, hemophilia is a genetic disorder. Obviously, in two-thirds of cases, there should be somebody in the family, though the family may not realize, what the similar problem is happening, or in one-third, there will not be any family history. So, the lot of times the parents fail to recognize the extent of the problem, or they neglect, because they don't have an idea to that baby needs some problem that needs to be taken to the doctors for the investigations. So there is, I would say, nearly in around 25 to 50% of instances, these hemophilias can be lately recognized of even after 5 to 10 years of age. That by the time, particularly in severe hemophilia, they can have a considerable damage into the one or two or few joints. So it is very important, something consistently happening repeatedly with some kind of trauma, without trauma, that bleeding into the muscles or joints or any other major organs or into the considerable bleeding, they should bring to the notice of the doctors and to be investigated.
Coming to the treatment part, what are some of the advancements when we talk about treatments, breakthrough in treatments which you have witnessed in recent years that has given hope to patients and their families?
Certainly, regarding the management of hemophilia, if we take the numbers wise, for the projected numbers are around more than a lakh should be in India, but unfortunately, only 25,000 of patients with hemophilia recognized till now. At the same time, there is a considerable advances in the management, that means in the investigations, treatment, and there is a lot of activity happening from the professional side, from the doctors fraternity and the government side and the NGOs. Certainly the management of the hemophilia changing in leaps and bounds. First, if we talk through initially 40, 50 years, they were giving the blood products, but now specifically the factors are available. In there is a lot of advances in the factors also, by extended half-life. So that is now available. The government across the India is supporting these patients through the district government hospitals. That means each district government hospital has a center to treat these patients. Only thing, the family should get properly properly uh, counseled to reach their the near vicinity to get the factors, so that the damage of the joints can be brought down. And that's one part. And the second part is the what are the latest developments. If we look at it, there are various areas, like there are novel agents which the kind of the medicines like emcizumab can be given once in 15 days or once in month, even not into the veins. There can be subcutaneous, like any insulin, like in using in the diabetes patients. So that much more brings down this frequency of the bleeds. Now that means if now factors being given in appropriately, just immediately after the bleed, it will bring down the kind of intensity of the damage, and they can lead and resume their lives. And also even the fact is now they are prophylactically giving twice a week or thrice a week too, in order to prevent the bleeds. Not only that, now there are the new drugs like MCC-MAB can effectively prevent these bleeds. And they can, the annual bleed rate, which supposedly in around 10 to 15 in severe hemophiliacs, can be brought down to 1 to 2 and even sometimes 0. So these new drugs are available, not only the emcizumab like novel agents, there are many more coming in the future. And also another important latest development is gene therapy. Now, particularly to certain extent, reasonably it's successful in hemophilia B, and there is a lot of work to improve the efficiency of the gene therapy in hemophilia A also.
So you have given a complete, very precise overview of the treatment modalities. Coming to the psychological aspect, do you think counseling is an important part of the overall journey of patients, caregivers की counseling, family counseling? What role does counseling play in the overall scheme of things?
See, in compared to the Western countries where they have a systems to diagnose each and every patient existing in the country, whereas unfortunately in India, which supposed to be 1.5 lakh patients, we only diagnosed to only 25,000. That means probably majority of these patients are severe type. By the time they're being diagnosed, they're being brought to the kind of a notice of the doctors and particularly the hematologists, considerable kind of damage, considerable complications would have been noted with these patients. Certainly, these families are needs to be counseled appropriately immediately after the diagnosis. First and foremost, we need to counsel them in detail, at least in few sessions, not 1 or 2 sessions, about the disease, pattern of the disease, and what are the manifestations it could have, and how to treat effectively so that a patient or a child can lead normal life to like any other child to their age. That is very important. I think they should have a kind of a good quality of life as if a normal child where they can go to the school, they can play with as any other child, and then they can attend the education properly, and the kind of the not only the educations, the work wise or all other family life, everything should be normal. So we need to achieve that. First and foremost is to counsel the family. Once we start counseling, make them to have a faith on what's happening, the child or the patient will get a better quality of life.
Sir. So when we talk about, hemophilia, you have very rightly pointed out that counseling does form an important aspect of treatment. But what about communication? Because people do not come out and talk because lack of awareness is there when we talk about this disorder. So
Certainly.
yeah, so what are some of the ways through which we can, initiate and promote open dialogues and awareness can be created?
No, certainly, I think it's our kind of a intent to work in various levels or in various areas. What rightly you said, how to make this family to participate appropriately so that they will have a one confidence to get treated properly and to make sure that child or patient gets a normal quality of life and healthy life. That's very, very important. How it would start? One, I would say we need to provide a kind of information through various like booklets, brochures about the disease treatment, and the videos and online accessibility to so that they start realizing what is the better way to do it. And second one is to organize small group meetings where like with other families, and also allowing to attend the talks by the professionals like hematologist, pediatrician, or adult physician, dentist, and the physiotherapist, and the psychologist, and they also some of these educational people who can provide the counseling about the academics and education and the jobs and the other things also. And this how it helps the group meetings among the families who being affected, and the bringing the professionals to that kind of platform, and also now and then organizing, getting the kind of a, various people who got a very good understanding and then expertise towards these groups. So their quality of understanding will be much more better, and they gain the confidence.
Yes, sir. So when we talk about hemophilia as a global concern, what are some of the ways by which different countries, nations can come together to share best practices, latest research and developments? And you very rightly pointed out how patient support groups play an important role in reducing stigma, creating awareness. But what about coming together of all countries to, for sharing of best practices and research and development may if we focus on them,
Yeah,
how
there
would
are
that
there are a lot of platforms there that's being, one of them is the World Federation of Hemophilia. There, with the help of the various countries, governments, and that is government organizations and non-government organizations and industry, pharma industry. There are a lot of platforms are there where they conduct regular meetings for the parents, families, and then particularly teenagers and adults to kind of boost their confidence levels and to get the right information, to participate in the meetings and to achieve the better thing. And also they're doing training, the doctors who being involved, physicians being involved, and also the governance bodies, because they also need to be touched to provide the right care in the right manner. So that's been happening. The sharing, the knowledge is there, and there are several platforms being done last several years, not even probably I would say it's been happening last 2-3 decades very effectively. Very.
that is really good to know that the work is already in progress. Coming to expecting parents who are concerned about the, since you rightly pointed out at the very beginning that it's a genetic disorder. So if expecting parents are concerned about the possibility of hemophilia in their child, what are the proactive steps or screenings that they can take during the prenatal stage, which are available?
Now, certainly, in all our encounters with the family, when the disease being detected, we try to kind of educate them that they should be attending the genetics department at various cities, so that they're being counseled by the geneticist in a, kind of, so that the subject will be reiterated again and again. But certainly all these children who being diagnosed ideally should have a mutational study, first in number instance about the index case, and two is counseling the families and encourage that any carriers in the family, if already the children index cases have got the brothers or sisters, and also trying to impress the family the right way the family should take, particularly for the next baby if the parents are young, and if the children are grown up, to detect the carriers in the family, to prepare the family, when this carrier gets married, how, what precautions they need to take. So that is a regular, I would say, as treating these children or patients is so important, kind of giving the proper genetic counseling is equally important. But in the India, like a country, we have a lot of social issues where families they don't come forward to get tests done, or they don't want even the tests done. They don't want to follow up what the geneticist or hematologist would say. Certainly, it will allow the increase the incidence of this hemophilia. Certainly, I see if we don't do properly, the incidence of the hemophilia going to be much more higher than what it's supposed to be. So it is very equally important as treating patient early, rightly, and taking them whatever the advancements happening in the medical field, so that they all the kind of benefits should go at the same time. The genetic counseling is equally important. So it is very important that we should encourage the council to the families to get a proper counseling.
Right, very rightly, sir, you have pointed out the importance of counseling. Any advice that you would want to give to especially parents who have just learned about their child's diagnosis and they want to know how to navigate the whole journey? Any lifestyle interventions? How can you ensure that the whole treatment outcome is positive for the child?
No, certainly, I would tell the family, I would encourage them once it's being diagnosed, always they should get these factors, replacement therapy appropriately so that they won't allow the child to go through any disabilities or limited their quality of life. So that is the most important. And we need to develop a system that children lead a normal life like any other normal child. So as on we have the factors available in few places in the city, at least 4 5 hospitals, and also each district around 15 centers across the state of Telangana. We have a designated this hemophilia treatment centers. So anytime the child encounter a bleed, should take to the nearest hemophilia treatment center and get early treatment. That is very important. And second thing is the attending the physiotherapy so that the child will have a normal healthy muscle and joints to lead normal life, and also the frequency of the bleeds would come down. So that's very important, so that you won't allow this child to go through any major disabilities for future, so that they can lead a normal life. That's one thing. And second thing is, without any hesitance, I think they should, kind of go proper genetic counseling. And third one is attending the group meetings frequently. I think parents should come forward themselves, willing to organize the small or bigger group meetings where they are, they are kind of accessible to the what is the right way of things happening, and second, the advancements what's coming through. Because every 2 to 5 years there is a lot of advancements happening, and I see that these hemophiliacs families shouldn't kind of go down with this kind of a chronic disorder. They should put all efforts, to do whatever is available, the best to be given to the child or a patient.
Coming to the last part, when we talk about the general public, how can general public, actively contribute in removing, like we have over the course of the conversation, we had talked about how there is stigma socially, it's not something that is acceptable. So what role can general public play in creating a conducive environment for the patient as well as for the family and
And
caregivers?
certainly the general public, what we need to kind of convince the community in a small or by and large is the recognition of this disease. That's very important. Anybody in their families, known people or unknown people, repeatedly happening this bleeding to more than the extent of the injury, that they need to be investigated. That's very important. And second thing is, the supporting this kind of a families who got a living with the bleeding disorders, the best ways at the schools or the colleges or even at workplace, how better they can kind of help out these families. That's important. And third one is that in future there are simple systems coming with the simple tests, whether anybody has got the hemophilia or bleeding problems, to get tested if there is any slightest doubt and make sure that they're not being involved. If it's being affected, they can reach the doctor's fraternity as earliest as possible. That is very, very important.
But we are almost running short of time. But before we let you go, I would just ask you for three major takeaways. One, for general public, how can they ensure in working towards the cause? Secondly, what would be your advice to the patients who have been diagnosed with hemophilia? And thirdly, how can families support? One bit of advice, though we have covered most of it in the whole course of conversation, but what would be your major takeaway to these three groups?
Certainly, the general public, what I would suggest, though it's not common disorder, but any bleeding problem, not only these hemophilias, there are rare other entities and sometimes platelet problems. Whoever has got a history of bleeding excessively than what they're supposed to be, or with the extent of the injury, that they should be diagnosed earlier. That's very, very important. And also, whatever the kind of activities or programs happening for the various these bleeding disorders, they should participate actively so that the message would be taken to the each and every family much louder. That's one. And coming to the family, once it's being diagnosed, I think they should make every effort to know about the disease, to know about the treatment of the disease, and taking a early treatment so that the child or patient can lead a normal life. And third one, if a patient or child being affected, I think they should be resilient to lead, because there are a lot of the treatments available so that they can have a normal life even as a child or later part of the child, adolescent or adult. They could lead and attain normal education. They can do the activities or the sports, not the contact sports, or they can work, because I have a lot of patients now, they are working very good jobs and attaining excellent kind of the careers. So I think, they shouldn't get distracted, or they shouldn't get, you know, disappointed about the disease. That's very, very important. And all the more it is a genetic disorder, all we should try to encourage the families or the communities and societies. If there is a possibility to prevent, we all should be in one to prevent these disorders. It can be done. It can be done.
Right. On this positive note, we'll take your leave, but thanks for being a part of this session. And I hope our audience will take away a lot of relevant information around hemophilia. And this session has, successfully tried to clear many myths and misinformation related with this condition. Thanks for agreeing to be a part of this session, taking out time from your busy schedule and joining us here. Thank you.
Thank you to everyone, to the audience.
Thanks,
Thank you.
everyone. And we'll see you again in another session. Meanwhile, keep following our social media for more updated information on health. Take care.